It's an initiative started by the Vascular Society of India, where we thought too many unnecessary amputations are being done in this country. And so, as part of that, now we are doing an amputation free Tamil Nadu. So we want to inaugurate that. Why are we harping so much on this amputation? In fact, somebody from the press came and asked me, what do you mean by amputation? Next. You know, globally, every 2 minutes, somebody is getting an amputation done. And most of these amputations are done for diabetes and trauma. So when you see an amputee next time on the road, please sympathize with him and find out why such a thing has happened, and could we have prevented this? You see this, you see this lady, just a young female who has lost both her legs. She came with acute ischemia, that is sudden stoppage of blood flow to her legs, and it was not attended to properly, and she ended up losing both her legs. So an amputation is so devastating for the patient, for the family, and if it happens to the breadwinner, the entire family is on the road. The important thing is, majority of these amputations are done for people with diabetes and after trauma. It happens because there are not enough vascular surgeons in this country, and the awareness about vascular surgery is also very poor. Many people don't even know what is vascular surgery. They confuse it with cardiovascular surgery. The vascular surgeons are the ones who deal with blood vessels outside the heart. Vessels in the heart and the heart itself is dealt with by the cardiac surgeon. All the vessels outside the heart, we deal with it. We are the vascular surgeons. Why we are talking about awareness? India has the highest, it's a diabetic capital of the world, and right now it is, we are supposed to have around 101 million diabetics in this world, in this country. And 6 to 7% of them develop diabetes. So all these epidemiological studies have been done by Chennai-based diabetic centers. So they are very authentic. And Indian population is also aging. So as age increases, the blood vessel block will also increase. You are as old as the artery. If the artery stays young, you will stay young. So that's very important to maintain that vascular well-being. And smoking is also going up. Smoking, age and diabetes are the three important causes for developing blood vessel block. So we expect a huge number of vascular complications because of our population. Are we really ready for that? You see, it's a very classical image. You see, you smoke and your foot undergoes damage. So you see here in this patient, all the toes have turned black, and you can see the agony in that patient's face. The tissues are dying because of lack of oxygen, and he's screaming with pain. And when the blood vessel to the leg gets blocked, you develop gangrene. When the blood vessel to the brain gets blocked, you develop stroke. When the blood vessel to the heart gets blocked, you develop heart attack. It's kind of the same disease, only the region is different. And there are around 300 to 350 vascular surgeons, fully trained vascular surgeons in this country. And there are another 200 cardiac surgeons and general surgeons with some exposure to vascular surgery. They also do. So you can imagine, for a country of our size and population, we hardly have enough vascular surgeons. But fortunately, Tamil Nadu has the maximum number of vascular surgeons because, like Dr. Ayappan mentioned, we are the Mecca of medicine. And we only started the first department of vascular surgery in this country. And fortunately, I am the first qualified vascular surgeon of this country. So, majority of the vascular training, if you see, centers, very few. You see places like North and East, hardly anybody. Nobody is there. So what happens to these patients who develop problem there? Either they have to come to Delhi or they lose their legs. So this is totally inequality. And majority of the centers are all located in Tamil Nadu. And I am very proud to say that Kauvery Hospital is the only private hospital approved by the National Board to conduct super specialty training course in vascular surgery. And there are only around 20 to 25 medical colleges in the country where there is a dedicated vascular department available. So when a medical student goes through the training, he is not exposed to any vascular diseases at all. So naturally his awareness about it when he qualifies is very poor. So this anomaly has to be corrected. And diagnosis is delayed, reference is delayed, and leads to neglect, and the patient loses the leg. And there are some startling facts you must remember about diabetes. So diabetes is gender neutral disease, that it affects the male as well as the females equally. Many a times women are protected from many other diseases because of the hormones, but diabetes is not forgiving. The gangrene is as common, or in fact more common in a diabetic woman than in a diabetic male. And majority of the time, a patient with diabetes gets admitted to the hospital due to the foot problems. And the most important thing is, 85% of these lower limb amputations in diabetics is preceded by an ulcer. That is, it starts with a small ulcer. You don't look after it well, it goes on spreading, or somebody goes around cutting the toe. Without improving the blood supply, it starts spreading and they ultimately lose the leg. And the risk of developing arterial block increases with the number of years of diabetes. If somebody is diabetic for 10 years, the risk is around 15%. If it is 20 years, the risk is around 40%. That is, 10ல 4 பேருக்கு ரத்தக்குழாய் அடைப்பு வந்துரும் if they are diabetic for 20 years. And one of the most important information of this talk is this, that many limbs are lost because of minor surgeries that are done in diabetic patients without assessing vascularity. Patient comes with an ulcer, small abscess, so a surgeon, plastic surgeon, general surgeon or a diabetologist goes and immediately puts a knife and drains the abscess. Okay, abscess has to be drained, but before that you should check whether the blood flow is there or not. If the blood flow is not there, wherever you cut will turn black again and the gangrene spreads. You would have heard stories in the family that எங்க அப்பாக்கு இது மாதிரி விரல்ல ஆரம்பிச்சது, விரல்ல கட் பண்ணாங்க, அப்புறம் பாதத்தை கட் பண்ணாங்க, அப்புறம் என்டையர் லெக்கே எடுத்துட்டாங்க, ஃபைனலி பேஷண்ட் செத்துட்டார். So this happens because nobody has looked at the blood flow. If you correct the blood flow, you can stop the problem with the toe. You improve the blood flow and you can remove the toe alone. But without improving the blood flow, you remove the toe, you cause more trouble. And the other important thing is this, 35 to 50% of the patients who lose one leg today will develop the same kind of problem next year, within 1 year. So that means if he loses one leg today, 1 year later he is going to be having the same problem and you lose the other leg also. So you have no business to remove the leg without improving the blood circulation. What happens in these patients, you see here, atherosclerosis is a cholesterol, that is fat and calcium like material which deposits inside, just like a soot in a chimney. ஒரு சிம்பிளாக சொல்ல போனால், ஒரு 1 inch pipe becomes a 1/4 inch pipe. So blood flow reduces in எந்த பாட்டுக்கு அந்த ரத்த குழாய் போகுதோ அந்த பாட்டுக்கு ரத்த ஓட்டம் குறைஞ்சி போயிடுது. ஸோ லைக் ஐ செட், ஹார்ட்டுக்கு போனால் ஹார்ட் அட்டாக், பிரெயினுக்கு போனால் ஸ்ட்ரோக், காலுக்கு போனால் லெக் அட்டாக் ஆர் கேங்க்ரீன். கேங்க்ரீன் மீன்ஸ் டிஷ்யூ டெத்.
வாஸ்குலர் டிபார்ட்மெண்ட்ங்கிற ஒரு கான்செப்டே கிடையாது. அண்ட் 1994 வந்து சார் வந்து இந்த வாஸ்குலர் சொசைட்டி ஆஃப் இந்தியா அதை லான்ச் பண்ணாங்க. அதுலேருந்து பார்த்தீங்கன்னா தஸ்வை பிகாஸ் ஆஃப் டாக்டர் சேகர் சார் இவங்க இனிஷியேட்டிவ் எடுத்ததுனால தான் தமிழ்நாடு இன்னைக்கு வந்து நம்பர் 1 இருக்குது வாஸ்குலர் சர்ஜரியில். அவுட் ஆஃப் 20 மெடிக்கல் காலேஜ் எம்சிஹெச் வாஸ்குலர் சர்ஜரி ப்ராப்ளம்ல 10 வந்து தமிழ்நாட்டில் இருக்குது. அந்த சாரோட ரெப்புடேஷனில் அவரோட எக்ஸலண்ட் வாஸ்குலர் சர்ஜரி ஒர்க்கில் பார்த்தீங்கன்னா இந்தியா முழுவதுமே அந்த டிபென்பி அதே அந்த எம்சிஹெச் வாஸ்குலர் சர்ஜரி ப்ரோக்ராம் வந்து ஒரே ஒரு பிரைவேட் ஹாஸ்பிட்டல் இருக்குன்னா அது நம்மளோட காவேரி மருத்துவமனை தான். இதெல்லாம் எங்கள் டாக்டர்ஸ் அத்தனை பேத்துக்கும் எங்களோட ஸ்டாஃப் அத்தனை பேத்துக்கும் எங்களுக்குலாம் மிகப்பெரிய பெருமை டாக்டர் சேகர் சாரோட ஒர்க் பண்ணுறது. தேங்க்யூ சார். அண்ட் ஆஃப்கோர்ஸ் சார் இஸ் சப்போர்ட்டட் பை மேடம் who has always been stellar in support in all the functions, all his clinical work. And after retirement, sir, I thought that he'll go home and take some rest, spend time with the family. but with the family support, the vascular department is growing each day. Thank you.